we're going to go ahead and get started. I think we have people who are on board. I am going to go ahead and I'll introduce myself. I'm Judy Bookman, and I am the Vice President on the Executive Committee for the Memphis Jewish Community Center, who has oversight, I put that in quotes, oversight of Fogelman Jewish Family Services. And Jewish Family Services, Fogelman Jewish Family Services, is the Memphis area serving agency for social services and mental health services that primarily focuses on the needs of the Jewish community. So if anybody out there is listening, I hope that you all know that one of the things that we hope you will do is pick up the phone during business hours and let us know if you have needs or you know somebody who does, because that's why we're here. As you may know, May is Mental Health Awareness Month. And one of the things we want to do as a community is focus not just on mental health needs, but also on the mental health needs and awareness of our particular part of the community. So tonight, it is my pleasure to welcome three panelists, or should I say four panelists, excuse me, Larissa and Jeff, who have experience with mental health issues. And they are, I have to thank you first and foremost for stepping forward, being able to communicate what has gone on and what is going on in your own lives in terms of mental health issues and sharing it with the community. This is not always an easy thing to do. And I applaud you all and support you in your efforts to expand outreach to the community and to let people know about your own personal journeys. So with that, I want to introduce the three panelists, and then we're going to move on into talking about some of the issues. Since we're limited to the hour, we're not going to be able to get as in-depth as some of us may want to, but hopefully we'll be able to follow up with more in-depth conversations in the future. First, I would like to introduce Rachel Epstein Morrison, who's with us this evening, and Isaac Krupp, who is with us this evening from Los Angeles. He grew up here in Memphis, and he has agreed to join us this evening, and Larissa and Jeff Kay, who are with us also. I have given them a list of questions, which I may expand a little bit in terms of if they say something I feel that we might want to know a little bit more, I may say, could you tell us a little bit more? And if those of you who are listening have any comments or any questions, please write those in the group chat. And if time permits, I will get to those at the end, but I don't want to interrupt the flow as we move forward. Okay, we ready? Okay, I'm going to start with Rachel.
Okay.
Rachel, obviously you've agreed to participate on the panel because you've dealt with mental health issues for at least a part of your life. And my question for you is, how has your life been impacted because of what you have been going through or what you have dealt with?
Well, it's been impacted in a lot of different ways and at different points in different ways. I was first diagnosed when I was 18 years old. I was a freshman in college. I was diagnosed with depression, and I was always a great student, but I couldn't focus. I had a real hard time, completing my work. I just lost interest in any activity I normally wanted to participate in. I had to force myself to go out with friends. My self-esteem was really low. I just really just didn't feel much purpose. It was also 1989, and there was not much talk of mental illness. So I was ashamed of my diagnosis, and I didn't want anyone to know about it. I didn't want friends. I was ashamed. So I hid it as much as I could. As I got older, got married, had a family, during depressive episodes, childcare, working, very difficult. Also, later on, had manic episodes, which we can talk about a little more later if we have time, but it's the opposite. Everything's extreme. Your self-esteem is through the roof. Everything is great, wonderful, and it sounds wonderful, but trust me, it's not. It's very scary. Your judgment's impaired. You don't sleep. You start doing things that seem completely normal to you, but very scary to family and close friends. So it's really has impacted all my life in one way or another.
Okay, we're going to come back with some more follow-up questions about that, but I'm going to move on to Isaac.
Same question.
Same question.
Um,
What brings you to the table tonight?
what brings me to the table? I definitely struggle with alcoholism, and what people, I think, a misconception of that is that it's just drinking or drugging as being the problem, and not all of the thinking and mental health that comes along with that once you stop doing that. All of the insanities and the lifestyle that came with being a teenager and definitely having an alcohol and drug problem. When I stopped drinking and drugging, I thought that my life was probably going to get a little bit easier, but I actually learned that the mental health and alcohol, you only really suffer from alcoholism once you stop drinking. And that's when I was kind of faced with Isaac and who I am, and what my struggles were without the answer and without the solution or the self-medication of the alcohol and the drugs. And it affected I realized self-esteem issues, definitely ability to work, concentrate, having not gone to school because I wasn't focused on that, how to be a husband, how to be an adult. I still feel like a kid, but when I was, my friends were progressing and I was not. There were definitely in every area of my life in terms of impulsive spending or, all the types of behavior that come along with the obsessive, addictive, package of alcoholism, without the drugs and without the alcohol, is something that is, with daily maintenance, definitely manageable. And I live a life beyond my wildest dreams today. But when you don't take care of the mental health and the spiritual health, you can go off the rails pretty quickly.
Rachel mentioned that she was first diagnosed when she was 18. At what age were you either diagnosed or did you know that there was a problem?
I became aware of the problem probably when I was 18. I acknowledged the problem when I was 21, but it was definitely a problem since I was 14.
Okay. 14. I want to emphasize that because I think a lot of people think that problems don't start until people get to be maybe 18, 20. But we also know that there are problems that start when people are much younger than that. So we're going to come back, obviously, to you all with more comments, more questions. I'm going to move on to Larissa and Jeff. I know that you all are not going to talk about your own mental health issues, but you're going to talk about it from a family perspective. And I think that's really an important piece for us to listen to this evening.
Sure. So Larissa and we lost our son, Sydney, when he was 14 years old. He took his own life. And I would say how mental health impacted us prior to that event was that, I've always traveled a lot for work, and it was always in the back of my mind, while I'm gone, is Sydney going to be okay? And it really overshadowed our other 3 children. And since then, we have a big hole in our lives and in our heart.
Larissa, I know that obviously you lost Sydney when he was 14. When did you all first become aware that there were some problems?
Well, Sydney was diagnosed with ADHD when he was in 2nd grade. We knew, obviously, prior to that he had symptoms of ADHD. He was your typical ADHD kid, if you will. Loved life, was always into everything, interested in everything, always was extreme. second grade, when he was diagnosed with ADHD, we started on a medicine for that. Everything was fine until middle school. And the transition to middle school was a nightmare. He had a lot of, social, I think moving into teenagehood, it was hard for him. He had a hard time transitioning, and that led to some anxiety and depression. And of course, even since Sydney was in second grade, we've always worked with his doctors and psychiatrist. And we always thought we were on top of it. We did everything that we could. Okay, so, our son is ADHD, so we're going to treat that. But it came along with other things. I think that a lot of us didn't realize how serious they were, including us as his parents and his medical providers. As much as he struggled, he hid behind his beautiful smile. And he, up until the day that we lost Sydney, was so engaged with life. He was on his hockey team. He was active in his robotics class. He was going to religious school. He was going to high school, and middle school. Obviously that had some struggles. And every time struggles came along, we dealt with them the best that we could.
Whenever we were seeking help for him, like, people would always say, oh, he would be better off not being in this program because we think that the influence in here would not be good for him. And we don't think that he's to the point where he needs to be part of this program. Let's make an appointment for this, to talk to a counselor or to a psychologist. And so he was, he either hit it really well or, he was very successful on his first time, but either way, the outcome was the same.
Let me just stop for a second and say, I think I have to express what I know many of us are feeling, and that is a respect for your pain, for your loss, and for the courage it's taking you to talk with us tonight. I want to go back to something that you mentioned earlier, and that is you said that he was a typical ADHD kid. And for those of us who don't know what that looks like, could you just give us just a little bitty snippet of what's a typical ADHD kid?
Sure. And so he never stopped. He would be, what appeared to be up all the time. I don't even know when he slept, but he would be going all the time. And
climbing the highest tree. He was always pushing himself. He took his training wheels off his tricycle when he was 3 years old. He was riding a unicycle when he was 6. He was always like going above and beyond.
And for things that were important to him or that he was engaged with, like 3D printing, and he mined from, thanks to him, I have cryptocurrency. I didn't even know what it was in 2017, but, he bought a little miner from a garage sale and he knew what it was and he plugged it in and he did his thing. And, he was super engaged, but if it was something that didn't matter to him, then, he could care less about it. So I don't know if that's typical ADHD, but that was Sydney's personality.
Of course, he had his struggles of focusing in school and paying attention, staring out the window. When we moved to Minnesota, one of his teachers had mentioned it was snowing And so Sydney was the only kid in the class just like gazing out the window because he was from Tennessee. He had never seen snow before. He was mesmerized with it. But, you know, he was just curious of the world. We just thought, you know, he just, every time something was a little out of the ordinary, oh, that's just Sydney. Or like, he was very talented in so many ways. And he was always hyper-focused, I guess. If he was interested in something, you know, I think that he probably could come off as a little much to others that didn't know him very well, but those that knew him loved him so much. And he was just an amazing kid. And we knew that Sydney had his struggles. We always struggled with Sydney, but never to that extreme. We never thought that that would be the outcome of Sydney.
You said something earlier that I think relates to the other members of our panel tonight, and that is that Sydney hid behind his smile. I'm going to go back to you, Rachel, and say, have there been times when you've hidden behind your smile?
Oh, for sure. Always. I mean, my entire life. It's just because that's what I wanted to do. And if you want to do it, you can do it. I mean, that's one thing with mental illness. And I would imagine addiction as well. If you want to hide it, you can hide it. And I chose to for a long time because, again, it was the shame and it was just easier. And I just wanted to be normal. And like, you know, I thought everybody else was normal. And, you know, little did I know at the time, but, you know, just, yeah, I mean, it's easy to do. You just smile and everyone thinks everything's fine. And I don't recommend it, but yeah, I did it for a long time.
Do you still do it? At times?
Not at times, but it has been so liberating for me just to be honest and open with my story, sharing it. First of all, I hope it helps others, but also just for myself, it's just like I feel this weight lifted off my shoulder. And just, I mean, it's only been in recent years where I'm just like, what am I doing? Why am I hiding this? I have nothing to be ashamed of. And I want people to know what I'm going through. And yeah, maybe, but it's rare. And it's not around people that I care about. I mean, maybe it's not like I run out to, you know, run down the street or if I'm at the store to yell, I'm bipolar to everybody. But yeah, not very often do I do it anymore. I'm much more open now, which is uncomfortable for a lot of people. But, you know.
Not as uncomfortable for you anymore.
Exactly.
Okay. I just want to, I don't want to throw us all with statistics, but I will tell you that prior to the pandemic, the estimate was that 18% of us have a current mental health diagnosis. That doesn't necessarily mean a permanent diagnosis, but a mental health diagnosis. That was pre-pandemic, and the estimate now is closer to 35%. Because of some other things that we can talk about at another time, but obviously isolation, loneliness, lack of routine, the kinds of things that obviously contribute to ongoing mental health issues. Isaac, did you hide behind your smile?
That got me through up, it still gets me through. I didn't have to fake it. That smiling and being happy is my natural state. The thing for me that I've actually had to learn, and it's been the most challenging but the most rewarding, is how to be sad, because I was so obsessed with wanting to be happy and feel good that I did not know how to be sad almost. And when things did not go my way or I would get sad, I was so scared and anxious to be sad that my meter went from happy to almost rage instantly, because I was so emotionally unbalanced, you know, and it really definitely affected the people around me. But it is something that I'm literally learning still every day, is when I get sad, it's not, oh, it's going to be okay. And there's being grateful, and there's having gratitude, and there's being positive and optimistic and all that. But I don't know if you've seen the movie Inside Out, but like the happiest of the memories are when joy and sadness join together. And like that movie was intense for me, because my whole life I'm known as Mr. Happy, Joyous, and Free, and be smiling, but I literally did not know how to process sadness. And sadness comes along with anxiety, and when you're stuck in, I don't know how to feel my feelings, as a teenager and early 20s, I definitely used drugs and alcohol to run away from that pit of anxiety in my stomach, as opposed to just learning how to feel it. And it sounds crazy, but I'm literally learning how to be sad, because it has been some of the most beautiful experiences are on the other side of that. And like someone mentioned earlier, you said it was probably easier to face that than, I forgot what you were referring to, but it's definitely easier to learn how to feel the sadness and experience it than to run it, shove it down, and do whatever you can not to feel it and bottle it up, because I am a rager when I do not process my emotions properly.
Was that the case when you were using?
No,
substances?
that was definitely the case when I was seemingly being told that I had to be an adult, and I did not know how, because in the important developmental years of literal biology in your brain, I was, you know, tinkering with the system and under the influence for a lot of the time. And when I was young and newly married and had a job, and I wasn't in mommy and daddy's house anymore, it was very challenging to process fear and to be grateful for fear and grateful for anxiety, and not to run from it with, you know, with everything I could.
You know, there's a theory in substance abuse and addictive disease lore that says at the time someone starts using substances, their development really freezes.
Correct.
And I think that's what you're referring to, which means if you started using when you were 14 or 15, that at the time you stopped, you were 14 or 15 developmentally.
Correct.
But you were married.
Correct.
So I think those of us who are listening can appreciate the conflict that must have set up for you and for the other people in your life.
It was very challenging.
I want to move on, and I guess this is going to be obvious for Larissa and Jeff, but I want you to go ahead and address it, if you will, and that is the mental health issues that you as a family have faced have obviously affected you and your children, and you mentioned that, your other children, 3. Who else? Who else has been affected by what you all have been going through and have gone through?
All of our friends and family. Everybody that is part of our lives. I'm just now, it's been almost 3 years, over 3 years. And I feel like just now I'm starting to become comfortable being around other people. And I feel like I've labeled myself as a mother of a child that's committed suicide. And maybe who I am, I always think of what's going through their mind. How uncomfortable is it for this person to see me? And I don't want it to be awkward. But I feel like every interaction I have with others, whether it's people I haven't seen in years or months, it's just a sensitive topic. I think it's very uncomfortable, of course, for anybody to talk about or want to talk about, but it's kind of like the pink elephant in the room. And I feel like I'm at the point now that I don't want to say comfortable, because that's never comfortable. It's never, I feel like I'm in a position where I'm accepting this is our lives now. These are our lives. This is where we are. And we have to move forward. We want to move forward. We have children to raise. We have each other to take care of and our children to take care of. And as hard as it is, you just got to keep going. But I have to say, the friends and community that we have here in Memphis, I mean, that's why we moved home, because from the get-go, it was just an unspoken, you're in good hands, you're home. You don't have to explain yourself. You don't have to share anything that you don't want to, or we're home. And the community and our family here is, and I think our faith is the only thing that is getting us through. And we want to do whatever we can to hopefully help others. I don't know how that is. I don't know, by telling our story, are we helping other people? Well, we're just the parents of Sydney that struggled, and we did everything that we could for her. And in hindsight, of course, there are red flags. I think the biggest red flags were in adolescence, when Sydney hit teenagehood, and hormones and your ADHD mind and just processing in puberty and all that. Your body's changing, your life is changing. Things are more important than they were a couple of years ago, because now you're hitting teenagehood and your mind's in a different place. A lot of Sydney's behaviors we thought were quote unquote normal for teenage boys, because you always hear, well, teenagers are really hard to parent. I think teenager with the mental illness of ADHD, and along with ADHD, many children also have underlying conditions, depression, anxiety, other things. I feel like we were always upfront with all of Sydney's doctors and physicians, psychiatrists throughout his whole life. There were times that were really hard and scary, and where we thought that Sydney was having an episode, if you will. We always took action on that, and I don't know whether it was Sydney hiding behind a smile, or the physicians being afraid to diagnose him or label him. But I kind of wish that, I feel like that we were kind of in the dark, because if we knew that there was something else going on, that we would have treated him a whole different way.
Let me just interject, as somebody who has been a teenager, raised teenagers, and worked with teenagers. A lot of what we consider within normal limits for teenage behavior looks abnormal. So that when we see teenagers who have mood swings, for example, when we see teenagers who have a problem expressing their emotions appropriately, who have a problem with impulse control, those are actually within, those are normal for teens. So I know that when you look back and you want to see what happened and what did we miss, there may not be those answers. And I know that my saying it isn't going to convince you, but I feel the need to say it to all of us who are here, because it's just not ever, mental health and working with people who are mentally ill is not always clear cut. It's not always black and white. Sometimes the target moves. Sometimes, as you say, people are good at covering up. And sometimes there's not a clear differentiation between normal and abnormal behavior. So it's not as easy as reading an x-ray, which I don't want anybody to think reading an x-ray is easy, but it's just not that easy. I'm going to ask you, Jeff, to chime in just for a little bit. I'm going to guess that the answer is going to be yes, but I want to hear your thoughts on it. And that is, has losing Sydney affected how you're parenting your children now?
Yeah, so definitely it has. And, I don't know if it's affected it for the good or the bad, but I would say that whenever we see behaviors that our other children are exhibiting, a lot of times, especially Larissa's alarm bells go off and she's like super hyper concerned. And I guess it's just more my personality, even though, everything that we've been through to still recognize that when a child is growing and developing, it's not exactly a perfectly straight line to the finish line. And so especially with Benny, because now Benny is 15 and, overall he's doing really well, which we're grateful for. But, sometimes behavior that Benny exhibits, we may exacerbate or be overly concerned about it. But at the same time, we need to let him be who he is and live his life. And he's a very different child than Sydney and has been from the very beginning. And so from that perspective, yes, from being more tuned in and acutely aware of our child's behaviors, I would say from that perspective, yes, as well. So whether it's right or wrong or indifferent, it has definitely changed our parenting style for sure.
Okay, thank you. I'm going to throw this out. I'm going to start with Isaac this time. Isaac, do you think you're cured?
Definitely not.
Say a little bit more about that.
I work the 12 steps of Alcoholics Anonymous, and the whole purpose of it is a daily reprieve. And they use the word daily for a reason. That doesn't mean if you don't practice one day, you are going to drink and die. But the purpose of it being, if you practice it daily and it becomes a part of your daily life, then your life is manageable. So what that looks like for me is maintaining a spiritual connection and working with other people. Being of service is the name of the game. And, Larissa and Jeff, you guys talked about you're not sure whether or not, telling your story affects other people. I know personally that when I have worked with someone else and shared my experiences with them, it has changed his marriage and kept him sober. That's me with one person, not the hundreds and thousands and millions of people that remain sober on a daily basis because of people like you and Jeff being of service to other people and parents and kids. So, it is a daily thing. And on the weekends and Shabbat, when I do not go to my daily meetings, I feel off. You can look at it as medication. Not that I'm against mental health medication too. I do that as well. But when you have a daily practice, it is an everyday thing. And my days are better when I practice, and my days are not as good when I don't practice. And that's, I wake up and I meditate. I write a gratitude list. I do prayer in different ways than I might have used to when I grew up. And I speak to other sober members in AA. and that's how I start my day at 5 o'clock in the morning every day.
I have to ask you this because I know a lot of non-Christians believe that the 12-step model is a Christian model, but you sound like you really embrace it.
I think, the 12 steps started from a Christian group, and Christianity going back comes from Judaism too. But the whole purpose of the 12 steps and AA and staying sober is whatever you want to call higher power, God of the universe. They say good orderly direction for God. They say group of drunks, whatever you want to call it, something other than you listening to your own advice. Because I know that when I do that, I usually end up in a tailspin. So when I, reach out to other people and have a higher power, God, and that's the whole point of AA, is spirituality and religion is the hardest thing that people, when they come in, get confused. They think it is a religious program. It is not a religious thing. It is a spiritual thing. And I have heard some incredibly spiritual and almost religious experiences of people helping other people and watched it in real time.
Okay. Rachel, how do you feel about the concept of a cure for your bipolar diagnosis?
I don't think there is a cure. I do think that recovery is possible for everyone with mental illness and addiction, but bipolar disorder is a chronic illness, just like other physical chronic illnesses. It has to be managed daily. For me, that includes medication. I have an excellent psychiatrist, one who has gotten me to where in the past I've had doctors say, well, you're high functioning and that's good enough. But this doctor, really wants me to be where I'm living what I consider my best life. I have a therapist, support groups. I'm a little jealous of the whole AA community because for the depression and bipolar, there's very limited options, at least here. But I might be trying to do something about that myself. Journaling, regular exercise, sleep hygiene, it's very important with bipolar. But no, I'm not cured. I don't think any mental illness can be cured as far as I believe, but definitely I feel very stable at the moment and hope to stay that way and, continue on this course.
All four of you have mentioned medication in some form or another. And I just want to go there for a minute. But before we do that, I also want to emphasize some of the other things that you all have touched on. Exercise, a routine, spirituality, 5 a.m. The idea that there are certain things that are non-medication related that impact your own functioning, your own ability to live your best lives at this point, I want to emphasize, because I think so often I speak with people who say things to me like, just give me the little magic pill. And I'm looking for you all to nod or shake. Have you come across the magic pill? And I'm guessing the answer is not a magic pill. But let's talk about, I'm going to go back to the case, medication and their ability to help Sydney when he needed help with his ADHD. Did you all find that to be useful, and would it have been problematic had he not had it?
So when he started taking ADHD medication in second grade, it was helpful for his school. He was able to focus. And he was on that regimen for 6 years until middle school.
No, it changed a few times because one medicine, he maybe made him feel bad, so they'd try another one, and then he had problems because he wouldn't eat during the day, so he lost a lot of weight. And so I would say that, I would say none of them were perfect, but we had to adjust it as he grew up and get as close as we can. But he didn't like taking them. I mean, like if it weren't for us every morning saying, "Oh, did you take your medicine?" he probably would not have taken it. And so I guess it probably.
Do you think that was because of the side effects, Jeff, or do you think that was because kids just don't like to take medicine?
I think it was because he wanted to be him, and he felt like the him on medicine was like a muted version of him.
And whenever we did take him off weekends or we would try like during summer camp, it was very apparent that he wasn't on his medicine, and it was problematic. So we needed to keep him medicated in order to keep him from being problematic.
Okay. To keep him so that he could pay attention and function in school and in different settings.
Keep his hands to himself and not be all over the place.
Right. Isaac, medication in terms of what you've been dealing with.
I was never on medication. I went to therapy, but I was not in medication. I was taking medication. I specifically remember when I was 21 and I got sober, I was very erratic and I was skipping and crying at the same time and happy and then sad. And it was like a lot. And they actually, for the first couple of years of my recovery, told me that my highs and lows were so great that I was putting myself at risk, not because I was going to do something stupid. I would do something stupid during a high or during a low. And I mean, from day one, it was effective. I kind of, as I got some time under my belt and was sober for longer, tapered down and got off of it. That was a mood stabilizer. And I then tried, I realized at my job that I was unable to stay present. And, I could have a million tabs open and I'm a good starter and a bad finisher. And I could have as many windows open as you could imagine. I just could not stay on task. So I actually was taking ADD medication and it was definitely helpful. And then I transitioned off last year, and I recently, within the last week, had brought it up to my wife that I think it's affecting my job because I have tasks and projects and in my inability to complete them at the proper time and keep my boss up to date. I see it having an effect just because of how scatterbrained I am. And it was helpful at my last job. And I'm actually having an appointment with the doctor tomorrow. Just called him yesterday. They had an opening because I'm not closed-minded to it. And to me, it can be people can use it as a crutch, or you can also use it as a tool. And if you use medication as a tool to put yourself in a position to overcome certain situations, maybe permanently, you can use it that way. Some people are on it lifelong. It's this, like we've said, it's not black and white. It's not, there's no one size fits all route to living a recovery way of life. But I think the stigma is you have to do it forever, or with medication, there's so many different types. You can getting the right medication, getting the right dose, getting the right everything is a whole concoction. And it sometimes takes time and causes a lot of stress and pain. But I'm seeing how my inability to focus and stay on task is affecting my daily life again.
So your self-awareness is good enough that you can monitor yourself and know that your attention has waned, and that you don't feel any pressure to say, no, I'm going to stick this one out. Correct. Okay. Rachel, let's talk about your medication journey, because I know it's been fairly complex.
Oh, it has been complex. But I have been taking medication since I was 18 of one type or another. Part of it is my diagnosis changed. Like I mentioned, I was first diagnosed with depression, and I think they gave me Prozac. I think that was all that was around then. And took until after my oldest daughter was born. I had severe postpartum depression, but I was also then diagnosed bipolar disorder type 2, which we don't need to get into all the different issues of that. But it wasn't until just really 3 years ago that it turned into type 1 bipolar. And it was actually medicine, an ADD medicine, that induced mania in me. But unusual situation. A doctor thought maybe it was ADD and not bipolar. Anyway, but it's bipolar. And I take, combination of medicines, quite a few. I have to have a pill organizer, but it's just one tool in my toolbox. But I do think I will be taking some form of medication for the rest of my life. I have to take mood stabilizers, sometimes antidepressants. They had taken me off of those for a while because those can cause mania also. But I have anxiety. There's some medications for that. That's bipolar disorder comes along with other. I forgot the technical term that you would know, Judy. But there's always usually other things that come along with it. But I don't mind. And like I said, I have a great psychiatrist right now who, tinkers with things. And, one time I told her, well, I think I'm okay. She's like, well, that's not good enough, So, you just have to be really honest with your doctor and yourself also, because you have to, it sounds like Isaac's extremely self-aware, and that's really important. And that enables you to be honest with your doctor and just work on getting that right combination, which is different for everyone. And I also believe, I was talking to my husband about the other day, that there may be different ways to get there. Like whatever I'm on now is working, but there might be another way. So, but I'm just, not trying to find that other way. I'm just saying, I don't think there's necessarily one right answer. There's a lot of medications out there. And, you also have to weigh the side effects. The bipolar medications, or some of them have extreme side effects. And so you have to, take that into consideration as well. But
the other part of that is that new medications come out quite frequently, and things that psychiatrists have in their and neuropharmacologists have in their toolbox now are not things that they necessarily had a decade ago. So I think that's important for all of us to keep in mind, that things change, and you all change, or people who are taking meds change. Even if it's not a question of moving from childhood to adolescence to adulthood, we go through hormonal and biochemical changes all the time.
Well, menopause was another big thing that affected me, because some of the symptoms and things of menopause are also bipolar symptoms. So at some point I'm like, I don't even know what's causing what, but yeah, you just have to take all those things into account. And I did have a doctor for many years who was very well respected, but he was stuck in his old ways and only prescribed certain things. And luckily for me, lithium, which is considered the gold standard, has worked for me, but I need it with a combination of other things. And there are a lot of newer medicines as well.
Okay, thank you. I know all of you have mentioned other things that are helpful to you. Is there anything else you would like to add that we haven't talked about that has really improved your conditions, improved what's going on? And when I speak to the K's about it, I mean things that you're doing now. I know you said you moved back to Memphis, and you knew that was something you needed to do. With that, I'm going to open it up to other things, but also the importance of support networks for all of you in terms of what you're doing. What is it that you get from those support systems, whether it's friends, families, or more formalized things like AA or mental health support groups?
Well, I'll jump in and just say I have to have a huge shout out to my husband. I met him when I was 19 years old, a year after I was diagnosed. He has literally been by my side every step of the way, and it has been very dark and very hard at times. And in the beginning, I wanted him to save me. And that was before I realized I had to save myself. But he's always been there holding space. I don't know where I would be without him. My children, who are now adults, they're 20 and 23, they've been amazing. Extended family, just for me, just really being honest with my family about what I'm going through and what they can do, and friends, and what they can do to help. Because people don't know. It's not like when you're sick, with other things, people don't bring casseroles or know what to say or do. They just kind of avoid you. And just letting people know what you need. And a good therapist really helps too. But yeah.
You touched on something, Rachel, that was huge for me and transformational, was self-care. I definitely was not aware that I was the one that had to take care of myself. Growing up, things I was taken care of, to the point where I don't think I knew how to take care of myself. And then when I got married and tried taking care of my spouse while she tried to take care of me, and we both avoided taking care of each other ourselves, that's really where I think stuff hit the fan the most. And you touched my wife, definitely, in terms of listening and opening my mind. Like, I think she's been the single strongest person to help me realize that it's okay to feel my feelings, because they were so extreme. And she definitely, like you said, Rachel, your husband's seen you through some dark times. Sober, I had some behavior that I'm not proud of. And like I said, it had nothing to do with the drinking or the drugging. It had to do with when I'm unable to handle my emotions maturely, or whatever that means. It looks like me storming in and out, packing my bags, running in, running out, just acting crazy. And I didn't know why. And the blame game, and it's not you, it's not me, it's you. And just looking in the mirror, learning how to look in the mirror and say, I love you unconditionally, Isaac, exactly the way that you are, period. And that is not something I picked up on up until recently. Just, I was told it my whole life by other people, and I did not know how to love myself. And when other people's love wasn't helping me through adulthood, because I didn't have it for myself, that's what self-care and self-love has been a game changer.
I have to interject. You all are clearly a unique group, but you're unique in another way that I need to point out, and that is that you all have spousal relationships that have not only supported you, but, well, that have supported you, because 50% of all marriages today end in divorce anyway. And when one partner has a mental illness diagnosis, or there has been extreme stress in a family, whether it is a suicide, whether it is the death of a child or the serious illness of a child, those numbers go way, way up. So there's something that's working in your relationships that I have to honor and highlight and say how special this must be for each of you all, to have that in your lives and to recognize that it's so important for you.
I think the figures for bipolar disorder may be as high as 90% of marriages fail. And I sometimes would say to my husband, why did you not leave? But thank God he didn't.
I was going to ask you if Anthony has an answer for that.
Well, he's at the Grizzlies game. We'll check back with him.
Okay.
He said, I wasn't going anywhere. Well, he had the attitude that wasn't you. I mean, he knew, from educating himself, that the things I did, I can relate to a lot of the things that Isaac said, because when I was in like a mixed state, which is a combination of mania and depression, you have this extreme rage and just completely irrational thinking. And, he said that wasn't you. I said, but it was me. It was me physically saying and doing these things. But he's like, I knew that wasn't you.
That goes back to some of the language that we sometimes use and have used in the past about mental illness. And that is when somebody says he's out of his mind, she's not in her right mind. It's actually saying that's not the person that I know or the person that I care about. It's something else that takes over. So it sort of goes with some of the way we use language to describe mental illness, I think. I don't want us to go too much longer than the hour, but I do want to ask each of you, I'm going to start back with the case. Do you feel like you've experienced any stigma from others? And Larissa, I think you touched on it when you said you wonder what people think about what you all have been through or are going through. Do you feel that it's stigma?
I don't know if stigma is the right word for what it is that I feel. I guess it is. Like, moving back to Memphis was so important because I felt like we didn't have to explain our situation to everybody. But then there were certain people, neighbors, schools, teachers that we did have to explain our situation to. And I don't know if it's a premeditated stigma, just like in my head that every time I would meet somebody new, whether it was a neighbor or a teacher, and I just felt like I had to tell them our background, our history. I just always put myself in their shoes. Like, I always felt like I'm dropping a bomb on them. Because some of these people I would have known for 6 months. I don't know how that we never had that conversation, but it got to a point in our relationship where I had to have this conversation. Maybe not 6 months, a few months. Of course, everybody's been very kind, and I don't know how other people feel talking with them. I can only imagine if I was in their shoes. I just don't want to portray things on other people.
And also, I think what we felt would be, we don't want to invite you to our house because we have this family photo and there's a kid in there who you don't know who he is and you're going to ask about it. And that's not the time where we want to talk about it. So it's like, before you come inside of our house, you either already know because you knew us before, or we've had that conversation prior to, so that we're not forced to have the conversation when we don't want to have the conversation.
Do you all talk about Sydney with your kids?
Oh, every day, all the time. His name is mentioned in our household as much as if he was still alive. And Lila was only not even
18 months.
Or 18 months. And she, it feels like she knows him. She always asked for my phone to look at pictures when she was a baby. So we talk about him every day.
Okay. Stigma, Isaac.
I think for me, both my wife and I are in recovery and we both struggle from mental health. And I think we went through a lot of pain, but me specifically, I went through a lot of pain getting to a place where what other people think about me is not my problem. I spent, and that's not my own, that's Al-Anon, but the obsession to control the narrative about what other people think about me, what other people think about us, what other people think about, they know me. I was, very young, and I was, a kid in Memphis, and I was this person. And then I got sober and got married and evolved. And I think I had to let go of my own stigma of who I was supposed to be and living the life that I thought other people wanted me to live. I never asked myself, what do I want? And I think that has been, for me, the almost stigma of the way that I'm supposed to be, and the way that I'm supposed to live my life, and the way that I'm supposed to have kids, and however I'm supposed to live on a daily basis. I've had to let go of that, and that has been very, very challenging, but rewarding, but painful and challenging.
How long did it take you to realize that you had to disregard other people's narratives about you?
Probably through, I just celebrated 5 years of marriage, and it was probably a little after the 3-year mark where I was acting so crazy. I was acting so crazy trying to control or paint this picture of someone that I thought that I was, that I didn't know that I wasn't, or might be, but just, I can't control what other people think. And that is very, very freeing. That's the most freeing thing that's happened through this journey.
Rachel, have you encountered any stigma?
The worst stigma I've encountered is self-stigma. It's what I've done to myself. From 18, just telling myself that how horrible I was and not worthy. And I did for a long time care what other people thought. But I do love that phrase, wherever it comes from, other people's opinion of you is none of your business. And when I really embraced that and stopped really caring, because I thought if somebody has some negative opinion of me because of my illness, that's not somebody that's important enough that I want in my life. But I think I put the stigma on myself for a very long time. Because of what society, when I was 18, it was very different. Mental health wasn't talked about. And so there was more of a societal stigma as well. And I just internalized that for a very long time.
Do you all feel that society has opened up about mental health issues?
I mean, I do, but, compared to when I was diagnosed, yeah.
Just wanted to sort of take the temperature of the room to see. We're getting ready to wrap up, but I wanted to ask each of you if there's anything that you haven't already shared that you think would be helpful to somebody who's listening right now who may be dealing with similar things, dealing with similar issues in their lives, or have friends or family that are.
And I would have said this anyway, and I've had this conversation with a lot of different parents, because it seems like people will reach out to us and ask, but also somebody asked it in the Q&A at the bottom. Let me read it real quick. I believe it was looking at the situation, is there any advice that you would give other parents? And so the advice that, I typically give is that, like, sometimes, when it's a child, they're not screaming out for help. They might be whispering out for help, and you have to listen very closely. And, if you have any concerns, they're probably, you probably have them for a reason, and it's always better to maybe take it too far and call 911 or take your child to the hospital or do whatever seems to be like the most extreme response to your child's behavior. But, if that's that's our biggest regret in life, is that we did not, listen close enough and react in the way that we needed to. And so it's better to overreact and be wrong about the situation than underreact and be right about the situation.
Okay. Isaac, anything else you'd like to share with us this evening?
I think when I was, even as a teenager and as newly married and still young, still a kid, I don't think I knew what I wanted or what my issues were, or that I was screaming and yelling. And I think that whether it's therapy or parents or whoever, I I think that solving the problem isn't always the answer, and sometimes just listening. And I think that when you don't even know what you don't even know, I can't hear an answer to a problem I don't know exists and apply the answer to my life. And I think that if, just definitely feeling comfortable to talk about being terrified or, excited, nervous, angry, happy, scared, whatever the emotional spectrum is, sometimes I've learned in my marriage, I always say to my wife, do you want me to listen or do you want me to solve the problem? Because I love solving problems, and sometimes, including for myself, I just want to be heard. And being heard is almost equally as important as figuring out how to stop the bleeding.
Thank you. Rachel, words of wisdom.
Well, I would just encourage anyone who's feeling, any type symptoms of mental illness or addiction. I would encourage them to talk to a trusted family member or friend, let them know what's going on. Sometimes when you're in an acute episode, it might be hard to figure out what you need to do, what resources you need, but there are people that can help you, friends, family. Like Judy said, I think JFS, has resources. Don't suffer in silence. There are people, you're not alone, and there are people that can help you. So I would encourage some people to reach out, even though it is hard, and it's hard to be vulnerable and share your feelings, but it's really important.
Okay. I have to thank each of you for all that you have shared with us this evening. I know that for me to listen to your stories has been extremely not just helpful, but moving. And I'm gonna have to say that I believe that the participants who heard you tonight have to feel the same way. Hi, Roshki, how are you?
Hey guys, I just wanted to pop on to say thank you to each of you for sharing your stories and being on with us tonight. It was really powerful. And Judy, thank you for moderating.
We thank you. I thank everybody for being here with us this evening. If you want additional information, please call JFS. The information and referral counselor will take your call gladly, and if we don't get the answer, we'll send you to somebody that may have the answer. So thank you so much for being with us this evening. If you have further questions, comments, please let us know. Again, thank you to our participants this evening. It has been my pleasure to be with you this evening. Thanks so much. Good night, everybody.
Good night.
Okay, thanks, Judy.
Thank you, Judy.
Bye-bye. My pleasure. Thank you all.